Hello everybody, Dr. JJ here. Hope you're having a lovely day. Thank you very much for listening and watching. This is Dr. JJ, Naturopathic Doctor from AskDrJJ.com. So let's get right into it. We are talking about glutathione today, more specifically IV glutathione, which is a great treatment. So let's get into it. So glutathione is something called a tripeptide. A tripeptide is basically a combination of 3 amino acids, so 3 proteins. Think of them 3 smaller proteins. So it's a combination of cysteine, glycine, and glutamic acid. That's why you'll see on the shelf people will advertise something called N-Acetylcysteine, NAC, as a precursor to glutathione, because cysteine is one of the precursors to glutathione. So that's why you'll see NAC often being used as a glutathione precursor or glutathione substitute per se. It is a precursor, but sort of substitute. Many reasons to use glutathione. So let's give you a lot of good information here. For your brain, it helps to modulate the brain's susceptibility to oxidative stress. So very useful for many brain conditions. You tend to find lower levels in Alzheimer's disease. You tend to find lower levels in Parkinson's disease. Also very useful for the lungs. It's one of the first lines of defense for the lungs. The lungs are very sensitive to airborne attacks. Airborne toxins, infections, and also just pure oxygen can be very damaging to the lungs. So glutathione helps to modulate that. You tend to find lower levels of glutathione in premature infants. So these are babies that are born before term. And you also tend to find lower levels of glutathione in patients with ARDS, so acute respiratory distress syndrome. Also useful for COPD, and also I find asthmatics tend to benefit from using glutathione. Liver, you can't think of glutathione without considering the liver. It's one of the main detoxification proteins. I use it a lot in many of my detox combos. It's often a key ingredient in a detox combo, depending on how deeply you want to detoxify. Used a lot in fatty liver. So the naming of fatty liver is changed a bit. So it used to be called NASH and NAFLD, NAFLD. So now NAFLD, which is non-alcoholic fatty liver disease, is now called metabolic dysfunction associated steatoic liver disease, MASLD. There you go. Just you could use it in Scrabble if you wish. So you tend to find lower levels there. Also, too, glutathione treatment seems to help to prevent the progression from early fatty disease, this MASLD, into NASH, or the new nomenclature, which is MASH, so metabolic dysfunction associated steatohepatitis. So it seems to prevent the worsening of a fatty liver. Really is kind of the easiest way of looking at it. So very useful for that. If you use a lot of acetaminophen, so acetaminophen over the shelf available as Tylenol, for example, or paracetamol. If you do a lot of it, it'll deplete your glutathione, so just be careful with that. It tends to be lower in patients that are alcoholic, and it contributes to liver cell death and liver cirrhosis. So liver cirrhosis is when the liver becomes inflamed and fibrotic, so that's not good. We don't want that. That's how the liver gets injured, and you could have some permanent problems from that. Also now there's been something called an FIB4 calculation. So this is you need some liver enzymes tested, and you need a CBC to get your platelets, and it allows you to measure the risk of fibrosis to your liver when you have a fatty liver condition. So these blood tests can be ordered through me, or they can be ordered through your family physician or your nurse practitioner to determine your FIB score. So we'll do another video on fatty liver more specifically, and I'll show you a chart on FIB4. So let's stay tuned for that. Heart disease, we found lower levels of glutathione in patients with atherosclerotic plaques. That's that thickening you see in the arteries. When you have lower levels of glutathione, it's associated with a risk of heart attack or stroke. Also, too, glutathione has been shown to reduce inflammation in the heart. For diabetics, it's patients that are diabetic tend to have lower levels of glutathione. Patients that have metabolic syndrome. So metabolic syndrome is kind of like an early diabetes. So you have insulin resistance, you might have some abdominal obesity, like a little bit of fat around your belly. So that's kind of the beginnings, maybe some lipid issues. That's the beginnings of metabolic syndrome. So people with this syndrome tend to have lower levels of glutathione. It definitely has an action on glutathione and insulin. Aging, glutathione levels tend to decrease with age. One of the reasons you might see it in sort of a longevity or anti-aging protocol. So that would be a good addition, especially for the eyes, which we'll get to in a sec. Immune system, you tend to find when you have lower levels of glutathione, it seems to have a negative effect on the immune system. You tend to find lower levels of glutathione in certain infections. So for example, HIV infected patients tend to have lower levels of glutathione. You tend to find lower levels of glutathione in patients that are viral hepatitis. So in hard to treat infections, or sometimes when people are stuck and they can't shake an infection, glutathione could be something to consider. In the eyes, I touched on that before, especially for aging. Glutathione tends to be, you tend to have lower levels of glutathione associated with cataracts, lower levels are associated with glaucoma, and also lower levels are associated with macular degeneration. So I find for many eye conditions, glutathione just sort of fills in the gap and is very helpful. And I've used it a lot for that and seen it to be beneficial for that. Also for the skin, it's got some great anti-aging benefits. Woohoo, anti-aging. And also it helps to change the type of melanin in your skin. So how do you take it? So that is the challenge. Absorbing glutathione orally is not as straightforward as it would seem. If you're taking a general glutathione product, like for example a reduced glutathione product, normally what happens is your body will break it down into the 3 amino acids, those 3 proteins I talked about at the beginning of this presentation. So it doesn't get absorbed whole. It gets absorbed whole if you take it in the acetylglutathione form, so that's usually my preferred form, or the liposomal form. So liposomal form encapsulates the whatever you're delivering. There's liposomal vitamin C, glutathione, CoQ10, et cetera, et cetera. And it basically allows you to just cross and deliver it into the cells. So it's a different method. It's kind of like the slimy gel if you've ever had it. It doesn't taste very good. So my preference is to use liposomal more for neurological issues. For everything else, I use acetyl glutathione because you can take it as a capsule. It's a little bit less expensive because glutathione is, on the more expensive price range of the supplements. Yeah, and then NAC as a precursor. NAC also has good properties on its own. Very useful for breaking up mucus and sinuses, or we use it a lot for lung issues too. It's very good at dissolving mucus, so we use it a lot for infections there. So it's got its own kind of personality, and it also precursors to glutathione. So it's a good one. IV, often a preferred choice because you just basically deliver it, straight into the arm. But now it does require an injection. So when we use it intravenously, I use it a lot for infections. I use it a lot for eye conditions. We use it for patients with skin complaints, lung issues, for asthma, for example, and definitely for liver health. Would be a good route to do it intravenously. For lung issues, you can nebulize it. So if you're familiar with a nebulizer, it's a device where you put in the liquid glutathione and then it turns it into a mist and you breathe it. I found that's been helpful for patients who've had some lung concerns. We've had some firefighters use that. I find it to be helpful. So that's a nebulized thing. And lastly, you can get it as a cream. So for melasma, some patients will get like these kind of like not birthmarks, but hyperpigmentation around their eyes. Some patients will get hyperpigmentation during pregnancy, after drug reactions, thyroid conditions. There's different conditions where you end up with pigmentation, and the cream I found has helped for that, just to kind of fade those a bit and even out the skin tone. So that's glutathione. So a lot of things we talked about. It's information, and you would want to see if it's right for you. So either talk with your family doctor, nurse practitioner, or a naturopathic doctor, or someone like myself, another naturopathic doctor, to see if it's right for you. So I hope you found this helpful. And any more information, please feel free to visit me on AskDrJJ.com, subscribe to the channel, and we'll keep posting videos. And thanks for watching, and thanks for listening. Alrighty, take care, bye.